You can't afford to skip this video if you're on ADHD medication or if someone you know is on ADHD medication. Please listen to this video and share it with anybody that you know that is taking any ADHD medications. A patient who was on Elvans, if I remember correctly, he had gotten the Elvans from a private provider. They started him on the 30 milligram dose. I think they checked his blood pressure and his heart rate at the time, but afterwards they increased the dose to 50 and then to 70, and I think there was missed opportunities after these dose increases to check his blood pressure and his heart rate. After he went up to the 70 milligram dose, he basically explained to his friends and his family that he was not feeling too well. He felt very exhausted, and he described it as feeling weird. I think that was the term used. And basically a few weeks later he passed away, and when they did an investigation into his death, they found that the medication could potentially have contributed to this. And what do we learn from this situation? So first and foremost, if you're on ADHD medications, you need to ensure that you have adequate monitoring in place, whether you're with a private consultant or whether you're getting it through the NHS. And by that I mean that on baseline your blood pressure and your heart rate should be checked, potentially an ECG as well, and then after every dose increase you should have these things checked, and every 6 months, even once you're on a stable dose, you should have heart rate, blood pressure, weight, and also have just like a review. Now the issue here was that for this patient, that those things were not done on the dose increases. And the other thing was that there wasn't written information provided, it seems, to him from his consultant to ensure that he had an awareness of what signs and symptoms to look out for in terms of like side effects with like the cardiac side of things. So I think from a perspective of informed decision making and being informed about what to do if you experience XYZ side effects, that information was missing for him. So I think it's really important, if you're on ADHD medications, regardless of where you're getting it from, make sure you have adequate monitoring in place, because it could be a life and death situation. My name is H. I'm a clinical pharmacist and I've been in general practice since 2017.